Good morning. So, welcome to the ninth day of neurology, and today we'll talk about the blood supply of brain. Right now, we have talked about this partially, but that was about the dural venous sinuses. Right, so this would be our action plan for today. For the blood supply of brain, good morning. Right, we'll divide it into say three parts. One will be when we'll be talking about the arteries. Right, that's how we shall start with. Then there would be veins, in which there'll be superficial and deep veins, and then finally the dural venous sinuses. Now, because we had already talked about the dural venous sinuses, so we'll just draw it, because all these veins, they will finally be draining into the dural venous sinus, and from there via the sigmoid it will go into the internal jugular vein, and that's how the circulation gets complete. Right, so our main focus would be on arteries and the veins. Right, considering that every time we'll say that these veins, they'll be draining into which sinus, right, whether it will be draining into superior sagittal or straight sinus. Right, so that's how our plan will go. At the same time, one more thing that we'll keep on talking about, that which part of the brain would be supplied. And in arteries, the circle of Willis, that is something which will actually draw. Sorry, that is what will actually draw, so that you also draw along with me and it will become much easier. Okay, and in arteries, if we talk about that in a very simple term, we'll divide it into anterior circulation and the posterior circulation, because we know that for the arteries there are only two arteries which will be taking part. Means it is the internal carotid artery, means as such two, right and left, right? But basically anterior circulation is by internal carotid artery, and posterior circulation, that is by the vertebral artery. Right, so we'll see that how exactly they form the whole circle and then they supply. Right, anterior, that would be going for the anterior part of the brain. Posterior, that will be taking care of the spinal cord, brainstem, and the cerebellum. Right, so as we proceed, we'll be talking more about it. Okay, so let's start with the arteries. Now, say in arteries, so this topic is pretty extensive, right? And I'll try to cover as much as possible. And in between, we'll be coming across some of the superb clinical integrations. So I am planning even to take you to that level, right? So in which there might be some of the ophthalmology, some of the clinical neurology, all those things, they will come into it. So it's not so that we'll be sticking only to blood supply, but what can really happen if that particular artery goes wrong, right? So that's how, so it becomes easier for us to remember the things. So in arteries, and as we said, the anterior circulation and the posterior circulation. Anterior circulation from both the sides, right? Internal carotid artery, right? Right and left, right? Internal carotid artery. Similarly, in the posterior circulation, there would be the vertebral artery, right? Vertebral artery. Again, vertebral artery, there is from the right side, from the left side. So that's how they come. Now we know this part, though it is pretty easy, but still, just just to just to say, cover up the things, that we are on the same page, right? Where exactly they go? Say this is the heart from the left ventricle, right? Here is the arch of aorta, and then there is brachiocephalic trunk, right, on the right side, and then it gives, right, this would be the brachiocephalic trunk, and then there is the right subclavian artery, and this is the right common carotid artery, and similarly over here there would be the left common carotid artery, and then there would be the left subclavian artery. our arteries, internal carotid artery, this common carotid artery will be dividing into two, right? So it is this internal carotid artery. The other branch would be external carotid artery. So internal carotid artery, that is branch of common carotid artery. So that is done. Vertebral artery, from where it will come? Vertebral artery is a branch of subclavian, right? So this one. So it would be from this one. So I'll take it like this, right? So that way we remember. So this is vertebral, right? And this will be passing through that vertebral foramen behind and will go all the way up, and then both these vertebral arteries will join together to form the basilar artery, right? So that's the origin. So this is just for our reference, right? So blood supply, this is those who have joined bit late, right? Just we have covered this much. Now let's see these arteries. Huh. Sorry. Now see, as such, things are pretty easy. This is basal view, right? Basal view. So that's the skull, right? That's the skull. Remove the skull. This is the brain and take the brain out. And when we see, right? When we see, so that's a basal view, right? So this is the basal view. Basal view. Easiest to understand. Two things. One, that's internal carotid artery. So this internal carotid artery will be one, and these are this one, right? This is the internal carotid, right? Internal carotid, and this one, that is the vertebral, correct? That is the vertebral, right? We'll also be talking about those nerves, right? Because that's important. We just see one thing: internal carotid artery, right? This internal carotid artery, how it enters into the skull. Now there is canal, right? The canal, it is what is called as the carotid canal. So from the base of the skull, right, it enters into the carotid canal, and then there is a tortuous course, right, into the bone, and then it comes out. So that tortuous course, that is what is called as the carotid canal. So it enters the skull through that, right? It won't be giving any branches in the neck. So over here, so that's the internal carotid artery. The keywords which will carry with us is enters via carotid canal, right? And this carotid canal is tortuous. It is in the bone, right? In the bone. So that's a tortuous canal. It enters the skull. Now there are four branches, right? Four branches. We'll keep on drawing, we'll keep on watching it parallelly even into our images, right? But to make things easier, four branches, out of which two branches, they would be major, two branches that would be smaller. I'm not telling that they are minor branches. No, they are very important. But instead of this major, let's write it like two big branches and two small branches, right? So take the page, right, and start drawing along with me. That's our carotid. So that carotid which has just emerged, because when we take the skull ulta, right, the basal view, so the carotid, internal carotid artery, it has just popped up. It has just come into the skull. So we are inside the skull. Two major branches, big branches. One would be, draw it like this, draw it like this, right? They are middle cerebral artery, right? We start with middle cerebral artery. This is for the drawing part, right? This is just for the drawing. So over here we'll write it MCA, middle cerebral artery. But there is one more artery which will be going up. So this is going like this. So this is anterior, right? and this one is posterior. So from posterior we can expect that we'll be calling vertebral artery, right? So this is middle cerebral, so very comfortably we can say that this one would be the anterior cerebral artery, right? We are drawing this thing just for the reference, then later on, right, just after completion of this figure, we'll go back to every individual artery and we'll see the clinical implementation. So this one would be anterior cerebral artery, this one, right and left. This side is always right, right? So anterior cerebral. Both of them, they will be communicating with each other. So join this. So this is anterior communicating, right? Anterior communicating artery, right? So far, so good. Next, as we said that it will be giving two small branches, right? Relatively small branches. So let's keep it on halt. Let's keep it on halt. Let's call our vertebral artery. So here is vertebral artery. Here is another vertebral artery, right and left. So we call this as vertebral artery. Both of them, they join together to form this one that is called as the basilar artery, right? Basilar artery. Now this basilar artery will divide. So it will divide, right? This is a big branch, right? It will divide, and that is posterior cerebral artery. So see how we have done. We have planned everything with reference to cerebral arteries. So there is anterior cerebral artery, there is middle cerebral artery, and this is the posterior cerebral artery. The part which is above, right, internal carotid artery is taking care of, that is what is called as the anterior circulation, and this posterior cerebral and basilar and all the way down, that is the posterior circulation, right? Let's connect both these circulation together, and this is connected by these arteries, and that one is called as the posterior communicating, because if this was anterior communicating, right, which was joining anterior cerebral arteries, so this is what is called as the posterior communicating artery, right? So as such, we have made this one, this is what is called as the circle of Willis, right? That is circle of Willis. This is circle of Willis. Now let's add smaller details, because even those details, they are important, right? So we'll change the color. Say this middle cerebral artery, right? Middle cerebral artery and anterior cerebral artery, we said that they are the two major branches. This posterior communicating artery is a small branch. There is one more small branch, and which will be going like this, right? Which will be going like this. So that one, which is so important, right? That is anterior choroidal artery, right? Anterior choroidal artery. So what I wish is that once we finish this image, right, when you practice, you try to draw this image, say 2-3 times within next 24 hours. So that way you'll remember every part very properly. And then just once a week, if you draw, right, even if you are sitting in canteen, so just take a tissue paper and draw it, right? Done. Very soon you'll start making it in your mind, right? So that way it'll become much easier. And say today, though, it won't be possible to show all the angiograms. Still, I'll show you something, but say to show you all the cases, because there are dozens and dozens of the cases, and it makes entire subject very interesting. So I'm thinking it for tomorrow, right? Let's see how much we cover it today, and then accordingly we plan. So anterior choroidal artery. So now we know that we have got anterior choroidal artery, right? Then posterior communicating artery. This one is our posterior communicating artery, right? So these are the two smaller branches, and this middle cerebral artery and the anterior cerebral artery, they are the two bigger branches. Done. Close. About the over here, there would be few branches. Few branches, they will be from here. Very rightly, they are coming towards center. So this is these branches. They are called as the enteromedial, right? Central arteries. Enteromedial central arteries. Done. So what about these? If that is enteromedial, so this one would be posteromedial. Correct. So posteromedial central arteries. Right. Done. This above that part is totally complete. Next, we need to think about this lower circulation. Something fantastic. Vertebral artery. A branch will come from both the vertebral arteries and they'll unite. Obviously, going towards the spine. So yes, it is anterior spinal artery. Good one, right? So that is anterior spinal artery. Then this area, right? This is a posterior area. So that is cerebellum involved, right? So that is cerebellar arteries will be there. So now we have superior and inferior cerebellar arteries, right? So first let's draw superior cerebellar artery. That is from this, right? This is superior cerebellar artery because cerebellum is posterior. So superior cerebellar arteries. Then that's the vertebral artery. So there is, I just remove this posterior because now you know it, right? So there is one branch which will be from vertebral artery. There will be one branch which will be from basilar artery. You got it? One branch which is from vertebral artery and one from the basilar artery. They both are inferior cerebellar artery. So we'll write it in middle, right? It is inferior cerebellar artery. Both of them. So we need to say justify. So let's name it as anterior inferior cerebellar artery, right? Lovingly called AICA. ICA, right? So then this one would be called as the posterior inferior cerebellar artery or the PICA, right? So that's how these are divided. Meantime, there would be some small arteries which will be coming from this. They all are going towards the pons, so that's why we can call them pontine artery. Done. Finished. Right? All the major vessels, they have arrived. Right? Now we'll be going into the detail. I'll keep on saving it. Now we'll be going into the detail of these arteries at an individual level. Sorry. So over here, now see, it is so easy, right? So we have got anterior cerebral artery, and the middle cerebral artery. ठीक? And these small branches in which, don't forget, the anterior choroidal, right? Anterior choroidal artery. And this one was easy, right? Because it was that communicating, right? So that anterior communicating artery. Posterior communicating artery, right? Posterior communicating artery. Because anterior communicating artery, that would be communicating between anterior cerebral, right? To anterior cerebral. So these are the four branches, right? So this is one, this is one, this is the second branch, two major branches, anterior choroidal and the posterior communicating, right? Posterior communicating artery. So these are the four for the anterior circulation. Now we see it in more detail in image, right? That where exactly are they? I have tried to zoom the thing, right? It is in fact the same image as that of this, right? same this. But over here, one side has been zoomed. So this one is internal carotid artery, right? This is the middle cerebral artery, fair enough. Then this artery which is going like this, right? So I remove this one, right? This one is anterior cerebral artery, right? Can you see a small artery which is connecting both the sides, which is connecting both the sides? This one, right? This artery, right? That is anterior communicating artery, right? And we have got two small branches. One is here and one is here. So this first one, that is the anterior choroidal artery, right? Though it is small but important, so that's why we have written full name over here, anterior choroidal artery. And this particular artery which is going over here, right, it is connecting anterior and the posterior circulation, so that is what is called as the posterior communicating artery. For rest of the arteries, you will be able to see, means able to identify so quickly, right? See how beautifully this is vertebral artery. They are both joining to form what called is the basilar artery. This basilar artery, this one is the posterior cerebral artery, right? All these are pontine arteries. See, right? Easy. Then we have the superior cerebellar and the inferior cerebellar arteries, right? This is superior cerebellar, right? Superior cerebellar, and this one is the inferior cerebellar. Then in this inferior, there is this one and this one, right? So that becomes the anterior inferior cerebellar, posterior inferior cerebellar, and that's that one is the this top one, that would be the superior cerebellar. Okay, so let's move on to the next one. The order in which all these branches they appear and why they are so important, right? We talked about, say, these four branches, the order in which they appear. So this is the first branch, that is the posterior communicating artery, right? Sorry. Posterior communicating artery, right? This is bridge between posterior and anterior circulation, right? This is like a bridge, right? Because it is connecting anterior circulation and the posterior circulation. Is it very important? No. Clinically, right? Clinical importance, if we say, nil, not much. Nothing more can go wrong, right? Because even the internal carotid and the basilar, they are big one. They are sufficient to handle the things by themselves. So this small channel, it won't be making very huge impact. But something can occur over here. And what we really want to see is this part. I zoom it. It's such a small structure, but when we'll be discussing it, you'll find that it is so important. Can you see a nerve? I'm highlighting it in red color over, sorry, let me highlight it in red color. This one. This is the area, right? See again, this yellow color. Or let's put it green. This, right? This one. So what's that? That is oculomotor. That is oculomotor nerve, right? So can it be affected? Because there is no specific importance of as this posterior communicating artery, but something can go wrong seriously when there is aneurysm. Now you know that what is aneurysm. Aneurysm, that is when the artery it bulges, right? When there is aneurysm of posterior communicating artery, right? When there is aneurysm, it would lead to oculomotor nerve palsy, right? It affects oculomotor nerve, right? Oculomotor, olfactory, optic, oculomotor, cranial nerve number 3, right? Oculomotor is involved. Now, what's the purpose of oculomotor? See, in our eyeball, right? That's our eyeball. 4 rectus muscles. Superior rectus. Rectus means straight, you know that, right? Inferior rectus, medial rectus, lateral rectus, right? And there are 2 oblique muscles, superior oblique, inferior oblique, right? So we have got the superior oblique and the inferior oblique. With these muscles, right, everything, all eye movements are controlled. Plus, right over here, plus there is levator palpebrae superioris, right? I'll just write it, levator palpebrae superioris. Nothing superioris, not a big rocket science. Simply these eyelids, right, they are lifted. Levator means elevate, palpebrae means this upper eyelid, superioris, right? Palpebrae means eyelid and superioris means upper eyelid. It will open the eyes, right? It will lift the eyelid, upper eyelid. Sorry. Our this entire movement, that is controlled by 3, 4 and 6th cranial nerve, right? This is lateral rectus, that is by 6th, right? Then our superior oblique, that is by 4th. Rest all by 3. So it is so important, right? So this 3 will be supplying superior rectus, right? Superior rectus, inferior rectus, medial rectus, inferior oblique, plus levator palpebrae superioris. That is involved, right? So when there is aneurysm of posterior communicating artery, then oculomotor nerve palsy can occur, right? What will happen in this case? When we say that oculomotor nerve palsy, right? Say this is cranial 3 palsy. The first thing which would be said is that there is limited movement of eyeball. Makes sense? Because so many muscles are involved, because only the muscles which are spared is lateral rectus and superior oblique, because they are supplied by 6th and 4th respectively, but otherwise rest of the muscles are involved. So obviously there would be limited movement or the difficulty in the movement of the eyeball. Makes sense? Second, levator palpebrae superioris, right? This is the eyelid. Eyelid is raised by this 3. Now this eyelid will be drooping, right? The person won't be able to lift it. That is drooping eyelid, as if he is in nasha, right? So bandi rehti ho. This is called as the, not ptosis, right? It is called as ptosis. P is silent, so it is called as ptosis. Fair enough. Because the muscles, they are not working properly, so that's why the eye, one or both the eyes, depending upon what, in this case, so there will be one eye that will be drifting on one side. Why should it really drift on one side? The reason is this lateral rectus will pull. There is no opposite, the medial rectus to oppose it, so that's why eye would be drifting to one side, right? You got my point? Because lateral rectus is functioning, medial rectus is not functioning. So there would be drifting, right? There would be drifting of eye to one side. one side, and this is called as the strabismus, right? So see, this is a good, parallelly we keep on learning even those few more extra terminologies also. So that is called as the strabismus, right? This is B, strabismus. So when it is drifting on one side, due to all these things, the focus becomes very difficult. So double vision comes, right? The person will be complaining of double vision. So that double vision is called as the diplopia. Diplopia, right? Diplopia. Now what I'm about to write is, you might ask, this is something which we have not talked about, right? There would be large pupil, large pupil, right? That pupil. And this large pupil, this large pupil is called as the mydriasis. Mydriasis. And story is not ending at this point. One of the very key thing is, just add big plus. It is not responding to light, right? Not responding so to light. And when you'll go in clinics, right, there would be one word, and that would be fixed pupil. Fixed pupil. Now you can definitely ask this question, that up to point number 1, 2, 3, 4, it makes sense when the muscles are involved, so it happens. When the levator palpebrae superioris is involved, so yes, that would be drooping of the eyelid, right? This is because of the LPS. That rest is all because of the muscles. Why this? Why this large pupil, and why it is not responding to light? Fixed pupil. The reason behind it is that this is where comes the autonomic nervous system, right? Autonomic nervous system in parasympathetic and sympathetic, that is, when the sympathetic is activated, that means fight fright, right? Because when you have to fight, you will fight with big eyes, right? And even if you have to run, you will open big eyes, that where is the path so that we can run, right? Big eyes. No, this is like making the eyes smaller. So it is like पेट भरा हुआ, right? आराम से सो रहे हैं, तो then that pupil will constrict. That is by sphincter pupillae, right? So this is a parasympathetic light reflex, right? One thing is, it is the parasympathetic system, right? Parasympathetic system. Superbly interesting things in neurology, because everything is like circuits, right? So this is parasympathetic, because then and then it will constrict the pupil, correct? It will constrict the pupil. Now that pupil which is to be constricted in presence of light, so we'll very rightly will say that this is pupillary light reflex, right? So whenever there is light reflex, so immediately, right, our eyes, they become like this, right? We shrink, it becomes so smaller, pupil becomes smaller. The, sorry, the reason is that there is involvement of optic nerve and the oculomotor nerve. They both carry this function, right? So it is a joint effort of cranial nerve 2 and cranial nerve 3. Right now, we are not focusing on cranial nerve 2, right? Because of the aneurysm of posterior communicating artery, our oculomotor nerve is getting affected. So that's why we are watching this, that why it happens that person is losing that light reflex. To figure out this, we have to just go slightly deep. We have to dive bit deep into our brain, and we have to figure out that why it really happens. Now see, this is the eyeball, right? This is the eyeball, and there is one muscle over here, and we'll call that muscle sphincter. Sphincter pupillae, right? So this is the muscle which will be taking care of making the pupil smaller, right? But everything is controlled by brain. So here is the midbrain, right? Here is the midbrain. There is one area which is called as the pretactal area. The pretactal area. Now, when we'll be learning midbrain in more detail, when we'll be learning in detail about the Edinger-Westphal nuclei, etc., so things will make much sense. But right now, we'll just understand that this is a path, right? This is one path. Pretactal area And from this, there is one nuclei, right? This is called as the Edinger, Edinger Westphal, Westphal nuclei, Edinger Westphal nuclei. In brain, it is nuclei. When these things are outside, they are called as ganglia, right? From here starts the fibers, right? Because there is one important ganglia. So this is what is called as the ganglia. That means it would be outside the brain. That's right. This is outside the brain, and that's why this ganglia is called as the ciliary ganglia, right? It is the ciliary ganglion, ciliary ganglion. And these fibers, they are before the ganglia, so we'll call it preganglionic fibers, right? They are called as the preganglionic fibers. And from the ciliary ganglia, there would be all those nerves, they will be traveling on. These nerves are very true ciliary, so they are called as the short posterior ciliary nerves. Short posterior ciliary nerves. It is this pathway which is involved, because all these fibers, they will be traveling via that oculomotor and the optic, right? Because see, in eye there is nothing like that, okay, there is extra channel for this parasympathetic fibers. No, they are traveling with those nerves, right? So that is where the if the oculomotor is affected, this pathway is affected. When this pathway is affected, we say that there would be, now one more word, ipsilateral, ipsilateral involvement, ipsilateral involvement. That means that if the aneurysm, if there is right sided aneurysm of posterior communicating artery, right? So right eye would be affected, right eye affected. Ipsi means same side, same side. Now we'll also be looking at some of the things in which there is contralateral. Contralateral means opposite side. It can occur very simple if the fibers they cross. If the fibers are crossing, so then there is pathology in the right side, right? It will affect the left side. But in this case, fibers are not crossing. Fibers are not crossing. So if the right side is affected, if there is a right aneurysm of posterior communicating artery, the right eye would be affected. Medically, scientifically, we'll say that there is ipsilateral involvement. Ipsilateral means same side, right? So now it makes complete sense. So parallelly, as such, if you see, we have finished the topic of this oculomotor palsy, in which there is limited movement of eyeball because of all those muscles. Levator palpebrae superior is drooping eyelid, that leads to ptosis. Lateral rectus pulls it on one side, medial rectus can't do anything because it is affected. So that's why drifting, this drifting is called as the strabismus. Double vision because focusing is involved. So this diplopia, large pupil not responding to light, which is called as the fixed pupil, because pupillary light reflex is involved, as these fibers, they are carried by nerve 2, nerve 3, right? And even 4. But over here, because 3 is involved in its large portion, so that's how it goes, right? Now, next is, so I keep on saving. So that was our, say, we are talking about anterior circulation, right? And in anterior circulation, we are dealing with right now internal carotid artery. In internal carotid artery, we talked about the first branch, and that is the posterior communicating artery, right? These are the branches of internal carotid artery. The next branch which will be coming out is, so that's our internal carotid, and this was the branch which was going down, right? That is posterior communicating artery, or the one. Another branch which we drew over there, the second one, and that is anterior choroidal artery, right? So this one is anterior choroidal artery, choroidal artery. Now this artery looks so small, but this is super powerful. super powerful, because if there is any damage, right, it leads to such major things in the body, such major things, because this anterior choroidal artery is supplying two mesmerizing structures when we'll be discussing this thing in more detail, but that is the basal ganglia. These are all time fascinating topics, and the internal capsule of brain. That's what it supplies, right? So how can we ignore this artery? This is so important. Interestingly, whenever there is damage, I'm changing the color, right? Damage. So damage to this anterior choroidal artery. Now over here the fibers would be crossing, right? When the fibers they cross, so that means there would be, very right, contralateral. There would be contralateral involvement. What would happen? Contralateral means opposite side, right? There would be contralateral hemiplegia. Contralateral hemiplegia, right? Opposite side. This opposite side can occur only if the fibers are crossing. Yeah, exactly. The fibers would be crossing. So what it would really do, right? See, we talked about basal ganglia, right? The question which might have arisen in your brain, basal ganglia. Well, when I used to study, same thing happened. That in brain, though there is no ganglia. In brain, though it is nuclei. So this is a misnomer. In basal ganglia, there are no ganglia, there are nuclei, right? But still, it is called as basal ganglia, right? So no ganglia, no ganglia inside the brain. Now we are inside the brain, inside the CNS. So then all those things they are called as the nuclei. So they are no ganglia, they are nuclei and nuclei. This is just for the name. Now when this basal ganglia, this is into the center of the brain, right? It is near center of the brain, center of brain. Now what it will do, its function is coordination, right? So it allows all different areas of the brain to work together. They work as one. So its function is coordination. So motor center, right? It will fire. Okay, chalo, give a punch. But then the where exactly to be hit, with what power, all those finer adjustment, writing, handwriting, right? All those finer adjustments, that is all handled by ganglia, this basal ganglia, right? Also, say its functions, right? Function one, it controls movement, right? Controls movements, decision making. So see, a small involvement of anterior choroidal artery, and because it is the artery which is supplying this basal ganglia, the decision making can be affected, right? One artery, then say all this, the way brain works on the principle of that reward, addiction, right? Addiction to something, all these things they are related to this basal ganglia. Then now if you really see this structure, right, that structure is pretty complex and it will require some time before say we talk about it, but just in general, how would it really look like? Because if someone tells basal ganglia, so we keep on thinking कि दिखता कैसा है, right? How it looks like, because it is this small, right? This entire thing, it is this small, such a small unit. So see, very schematic diagram, right? But it will give you the idea. Names are very interesting, right? So just draw it like this, as if this is some, and this. Bus. This much is sufficient. And now you know almost all of it. This is 1. This we write as 2. There is something which is underneath. So we call this 3. Right. This 1 is what? 1. 1. That is called as putamen. Right? These are all part of basal ganglia. So putamen. Right. This 2 is what? Right. The whole thing which is taking the curve. That is caudate nucleus. Caudate. Right. But see, still they say over here the name is correct. Caudate nucleus. Yeah, it has to be nucleus. Right. This 3 which we marked. Right. That is called as globus pallidus. Right. Globus pallidus. When we'll be discussing basal ganglia, right, all these things will be discussed in more detail. But here, it will give you just rough idea that how they really look like, right? Not only this much, we said that internal capsule, right? So over here, right, over here, this behind, there would be thalamus, right? The thalamus. Now there is a space between this is what, this is putamen, this is what, that is caudate nucleus. In between there is space, right? It is this space. That is the internal capsule. This is internal capsule. Internal capsule. Right. No doubt there are, this is say for example amygdala. All are awesome topics, all, right? Because then there is one more nuclei which is present just over here, which is also a part of basal ganglia, right? This is what is called as the subthalamic nucleus, right? This is subthalamic, right? So easy, just underneath the thalamus, because thalamus is above, so this is below, so subthalamic nucleus, right? And then there are small group of nuclei, right, which are present over here, present over here, present over here. Basically it is like olfactory, and then there is pallidum, etc. But right now we don't worry about it, right? Olfactory, etc. So I just write olfactory, ventral pallidum. These are the names, but plus plus right now it's sufficient. And then this is amygdala we talked about, right? So these are collectively called as the basal ganglia, and all of them, they are supplied by this anterior choroidal, right? So that's the reason it is so important. And when we say this internal capsule, will there be external capsule? Yes, there is external capsule also, because that external capsule is what all those, it is the route for those cholinergic fibers, which will be going from basal cortex to cerebral cortex, right? We'll talk about it when we'll be talking the capsule. But the whole idea was that whether it is basal ganglia and or it is this internal capsule, right? This internal capsule, because it is supplying both, na? It is supplying basal ganglia and it is supplying internal capsule. Who? Anterior choroidal artery. And we were telling that this is a small branch. Yeah, it is small, but it is supplying so big, because this internal capsule is supplying the physical movement and the perception, right? Perception. When you take a judgment, right? When you are running and you say, okay, say I want to jump this area, so that is the decision, that is the logic which you apply. So that physical movement, how much you are balancing, all those things plus perception, that is thanks to this internal capsule. So obviously when it is involved, it will lead to person won't be able to walk properly, right? And things will go accordingly. So this is the importance of that anterior choroidal. So we are talking about internal carotid artery. In internal carotid artery, we talked about first one, that is the posterior communicating artery, right? Done. Then we talked about anterior choroidal artery, right? Choroidal artery, okay, done. Now, rest of the arteries, they are big, right? So these are bigger one. The first one is anterior cerebral artery. cerebral artery. Now, as you have already drawn circle of Willis, so you know immediately that if this is our internal carotid artery, so that was the artery which was going like this above, right? So that's the anterior cerebral artery, which was talking to artery on the opposite side via this anterior communicating artery. And then there were some central arteries, enteromedial central arteries. Will not just write the name, but this was the thing, right? Enteromedial central arteries there. Where it supplies anterior cerebral artery, it supplies what? It supplies, now see, it is going anterior. This is anterior, right? And it is going towards the medial side. So simply it supplies frontal and medial part of brain, right? That's where it is located. Now if to confirm, if we go back to our figure, right, say this one would be better. This one would be better. See, this is the artery which we are talking about. This is where it is going from here, it is going up, right? So obviously this is the medial part and this one the frontal part. That's the part which is taken care of by this anterior cerebral artery. Okay. Okay. Yeah, this is one figure, right? It came at the correct time. This branch, this one, so anterior cerebral artery, it is this one, right? That is anterior cerebral artery. So now we know that, see, as it goes, right, it gives branches. So it is supplying the medial part, right? So that is our, so this is the section, right? So what we are watching is the right side, right? So this is the right anterior cerebral artery. Remember, right anterior cerebral artery, right, which supplies frontal and the medial aspect, of brain, that is supplied by it. Okay, next one. We need one page right here. So this anterior cerebral artery, when it supplies this frontal and the medial part, so it means it will be supplying the sensory region, it will be supplying the motor region, right? Supplying sensory and the motor region, and the region which are associated. This is the region which is associated with regions linked with willpower, region which is associated with the behavior. It means if anything happens, right, any injury, so it would lead to, now you can write very confidently that sensory and the motor, right, they are affected. There would be deficits and there would be personality changes, right? So crucial. As the age increases, that's, I saw one very good video. That person is Air Chief Marshal, right, retired, age 92 years. He has run several marathons, and in that interview he was asked that just give 3 tips to stay fit. First tip was, right, it was worth that: use your legs, run. If you cannot run, walk. If you cannot walk, swim. If you cannot swim, cycle outside. If you cannot do cycling outside, do cycling at your home, stationary cycle, but use your legs. First thing. Second, build your strength, right? Build your strength, lift weights, right? Give punch, right? So this is when you develop the strength. And third and very interesting thing was, right, usually neglected, brain will go into atrophy. right? Brain will start shrinking if you don't use it. So the best third tip was use your brain. And in past also I have talked about it, that use your brain. How will you use it? Those, start reading the language in which you are not very comfortable, right? Learn another language. Learn another language. I'm not telling that reading English book, right? It won't be, say, stimulate your brain. Yes, definitely. But when you start reading in some other language, at times you will be struggling. You'll be a bit uncomfortable, but that's where the success is. So this was a very nice thing which I learned from that interview. Interview is pretty long, but this was the crux of the entire thing. So this is where it really happens, that in case of any injury to this artery, it will lead to not only sensory deficit, right? Sensory plus motor deficit, but it will lead to behavioral changes, right? Behavioral change. And interestingly, you will find that many times few people, they are not that aged, but still there will be behavioral changes, right? This is what really happens, because not every day you'll be sending that person ke chal go and get your CT or MRI done. When you do the MRI, you find kare boss iska to brain, right? That when it is clearly mentioned that there is shrinkage of the brain, right? That's where they realize, and then by that time it's too late. It's just too late. We say brain and heart, those tissues, once damaged, damaged forever, right? There is no way, right? Whether you go in any of the country for the treatment, nothing can be done. Once gone, gone forever. So that's the reason, take care of it. And these are the matters of habit, right? We learn so many things, but what if we just can't take care of our own brain, right? That would be really, really very bad, you know. Okay, chalo. So that was our internal carotid artery, right? This one is middle cerebral artery. Then this one was what? Anterior cerebral artery, right? Then this one was what? That was the posterior communicating artery. Then this one was what? That was the anterior choroidal artery. Done? This is anterior communicating artery, right? Communicating artery. I've written all these things. There is one very fine artery, a very fine artery, you must know, right? This artery, which will be arising from anterior cerebral artery. This is, this is a small artery, but it is medial, going in front, so fronto. Coming towards base, so fronto-basal artery. This is medial fronto-basal artery, right? And where it will be going? It will be going for the orbital part of frontal cortex, frontal cortex. This artery, this area is for this cognitive process, right? All these higher intellectual skills. See, such small branches they are supplying, and they are making such huge impact on our decision making. So this is vital for decision making, this area, right? Decision making, the judgments which you take, you watch something and then you take the judgment. So that decision making. So in case if anything happens to this, it affects the behavior, it affects the decision, right? Now in upper limb, lower limb, every time we said that if there is anything like, say, if there is only one artery called frontobasal, so then we would have named it like frontobasal. But when we are telling medial frontobasal, so there has to be lateral frontobasal, right? There has to be lateral frontobasal. Otherwise, so we would have named it just like that. That's right. There is. And this lateral frontobasal, that will come from this middle cerebral artery. So that would be the lateral fronto basal artery. Till imagine we have not yet touched the middle cerebral artery, right? We just talked about all of them, right? We just talked about posterior communicating, anterior choroidal, anterior cerebral, and now we'll talk about the final one. See, that's the reason that the blood supply of the brain is so fantastic, right? Literally means it's like a miracle. So I'm writing few things again and again so that the revision becomes automatic, right? And when I say internal carotid artery, this is for the anterior circulation. Immediately, in this order only, the first that was the posterior communicating. So if you have drawn along with me the entire circle of Willis, you'll know posterior communicating, right? What posterior communicating can have can do? Posterior communicating means aneurysm. Aneurysm will affect cranial nerve number 3, oculomotor, and then tuck, 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 all those things. Chamaedria, diplopia, strabismus, right? So that is posterior communicating. Because see, parallelly, you will automatically know the importance of this such a small artery that if aneurysm can occurs, what can go wrong, right? Later on, when I'll be showing you the CT or the MRI plates, and in which I'll show you, can see this is the artery. See, this is the artery, and see how it looks like, as compared to the opposite side, right? This is where you see that, right? I won't be telling you that watch over here. I'll be giving you the symptoms that this is a patient age 70 years, female patient, and she developed, say, visual disturbances, double vision, and then I'll be showing you the plates, and then you find out, yes, this is aneurysm of posterior communicating artery, right? And yes, see, it is like mathematics. It is exactly like knowing how do you deal with all those circuits, you know? Okay, so that was the posterior communicating artery. The next one was very important, anterior choroidal artery. Anterior choroidal, that is basal ganglia and internal capsule. So all those coordination, movements, etc. Yeah, good, right? Then third one was anterior cerebral artery, right? We talked about it. And the fourth one, this is the middle cerebral artery, a big one, largest, right? This one is the largest. It will go on which side? It will go laterally, right? It is going laterally. So that's why this will supply lateral surface, right? Lateral surface of brain. Lateral surface, who will come? Temporal lobe, right? Temporal lobe. Over here, temporal lobe and the parietal lobes. So temporal and the parietal lobes. So easy, correct? Some part, right? Some part of the frontal lobe also, partially, right? So frontal, partially, partially. And we said that it will give a one important branch, which was that going like this, and that was lateral frontobasal, right? We just talked about lateral frontobasal, frontobasal artery. So this is about the anterior circulation. Done. Now all we need to do is we need to talk about the posterior circulation, right? And then after posterior circulation, we'll be talking about the veins, right? They are very few. And then all we need to see in that is that these veins, because these veins, they won't be following the course of the arteries. Arteries, they play different game. Veins, they play different game, right? Because veins, they will all be landing finally into the dural venous sinuses, and that dural venous sinus which we drew on that day, right, we'll draw it again today, and then it will drain into internal jugular vein and done, right? So from heart to heart, entire course would be completed. Okay, so coming back to this posterior circulation, and in posterior circulation it is the vertebral artery, right? Those vertebral artery which are the branches of subclavian, right? We saw that. So this vertebral artery, when it goes like this, right? We have already drawn this, right? This is the vertebral artery, and that vertebral artery, where exactly they join, right? This part, this is the basilar artery. basilar artery. All these things, obviously they will be joining just near the pons, right? Just near the pons. So this is near pons, right? As such, pontomedullary junction. But basically, if you say pons, that is not very much wrong. So that's where it occurs. And over here, it is leading to formation of spinal anterior spinal artery, right? This one and this one, that is vertebral, and this we said that is the basilar. It is giving one branch, right? We saw that this is giving one branch, and that was the posterior most inferior cerebellar artery, pica, right? Pica. You remember? Posterior inferior cerebellar, cerebellar artery, because now we are dealing with cerebellum. So this should supply whom? One to cerebellum, right? Cerebellum. And then it will supply the organs which are associated, the part of the brain, medulla oblongata, and then the spinal cord. Spinal cord. That's how it will supply. That's how it will supply. Another branch. This was posterior inferior cerebral artery. So then there would be another one, right? Just if this is from vertebral, this one will be from basilar. And this is anterior inferior cerebellar artery, right? So this is anterior inferior cerebellar artery. This anterior inferior cerebellar artery, cerebellar artery, that is associated with fifth nuclei, right? This is associated with fifth nuclei. So olfactory, optic, oculomotor, trochlear, trigeminal. So important. Trigeminal, which is a mixed nerve, right? It has got those three divisions, right? So it is this ICA, right? It's vital. It is supplying that lateral pons, cerebellum, and if anything goes wrong to this ICA, anterior inferior cerebellar artery, it would lead to facial paralysis, plus there would be sensory loss, right? There would be sensory loss. That's what it can lead to. Then there are other arteries which are like pontine arteries, right? They supply the pons. Then there was one labyrinthine artery, right? I'm drawing on this side for the clarity. Labyrinthine artery. Labyrinth, right? Labyrinth means what? I just put the star over here and I write it on another page. Star. Right? Sometimes name are big, but they're labyrinthine. Easy way to remember labyrinthine artery. Easy way to remember is this is auditory, right? This is the internal auditory artery. And this is, which is obviously it will be with, in association with cranial nerve number 8, right? Cranial number 8, and it supplies inner ear, right? Very rightly, you know that there is external ear, then there is middle ear, that is malleus incus stapes, right? Those three ossicles, and then there is inner ear. This supplies, this labyrinthine artery, it supplies inner ear. See, it is emerging directly from the basilar artery, right? Big ones. So that's why things are so important and so beautiful. Okay. What fun would it be if we don't talk about that, what can really happen in case if this posterior cerebral artery, right? The next branch is what? Posterior cerebral artery, you know, cerebral artery, because that's how it is dividing, right? So this was our basilar artery and this is our posterior cerebral artery. This artery bifurcates, right? This basilar bifurcates, and that's posterior cerebral artery. It is supplying the deep structures of the backside of the brain, right? Because this is posterior circulation, the biggest one. So it has to supply deep structures, right? Deep structures of posterior brain, right? That posterior brain it supplies. This is posterior cerebellar. Which part? When it is going back, right? So this is what? Temporal, and this backside is occipital. So two lobes, temporal and occipital, right? These are the lobes which are supplied by this posterior cerebral artery, right? So we, because temporal, occipital, parietal and frontal, these are the four lobes of cerebrum, right? So this is posterior, so obviously this is the temporal, right? And in that occipital is behind. But because these fibers they cross, the fibers cross, right? In case if anything goes wrong, say for example to this occipital infarct, if there is any infarction, right, there is lack of blood supply, so that would lead to one new term which you should know, contralateral, right? Contralateral, the opposite side. Homonymous hemianopsia. Hemianopsia you say, or hemianopia, one and the same thing, right? What's this? Now when we really look at the eyeball, now we find things are so confusing, right? Sometimes it is contralateral, sometimes it is ipsilateral, sometimes both the halves are involved, all those things, right? So in this case, its literal meaning is what? If this is the field of vision, right, there is blindness of, this is blindness of half visual field, right? This is blindness of half visual field. That is what is called as the hemi means half, anopsia means loss of vision. So there is hemianopsia, that is blindness of half visual field. Homonymous, so homonymous is what? This is one eyeball, this is another, this is right, this is right, this is left, this is right, we are watching, and this goes down and this goes down, both the sides, same side. This is homonymous hemianopsia. So either the right side vision is lost, so in both the eyes, right, in both the eyes, right sided vision. So obviously in one case it would be medial half, in one case it would be lateral half, whatever, right? But we can make it easy that in both the eyeballs, right sided is lost. So it is this situation. This is what is called as the homonymous, when it is on the same side. So same side of the half is lost. So both the visions will say that our right hand side is affected, right? Whether the left eye vision or the right eye vision. If you divide it into two parts, right, in both the cases, it is like this. When it goes like this, say for example, right, let's draw it. So if it goes like this, when this is gone and this is gone, so this is also hemianopsia, right? Because half of the field is lost, so we'll surely call it hemianopia or hemianopsia, one and the same thing, right? But this one would be called as the bipolar. This one would be called as the bipolar, right? Bipolar hemianopsia. Okay, how can it, why can it really occur like this? See the answer Answer is extremely easy. This is the eyeball, right? Very schematic figure. It should be scientifically correct, right? Not necessarily the artistic, right? So just draw this is how the fibers would go, right? So there is fiber. They will go, let's change. This is the half, right? So from here, these are all medial fibers. Medial fibers, they will go on the opposite side, right? The lateral fibers, right? Lateral fibers, they will go like this. The lateral fibers, right? Lateral fibers, they will go like this. And the medial fibers, they will cross and they will go on the opposite side. Fine. Now the confusion is removed, right? So we have got these two sets of fibers. So it means if there is any lesion over here, then the entire eye, one eye is completely lost, right? So this would be the thing. If, so this is one situation. What if the lesion is over here? Lesion is over here. This is two. So in this case, draw both the eyes. Which half would be affected? This is okay, right? So this is okay. So this is okay. Then this white line is cut, right? So it means it would be, this one would be affected, right? What about this opposite side? In opposite side, here this would be affected because green fibers, so they are not crossing, so that is okay. This one would be affected. This is what we were telling. Bipolar hemianopsia, right? This is bipolar hemianopsia. When we'll be talking about, say, ophthalmology, this thing will come in tremendous detail. But what about this? So this is giving you just a general idea. 3. When this is affected, start drawing. What would happen? Right? What would happen? Green, this opposite, this lateral part, this is gone. Right? And then opposite side, over here, this part would be gone. This is gone. Yes. This is called as the homonymous hemianopsia. Right? And then later on, as we progress, and as it goes into the visual cortex, and if there is any damage over here, any tumor, any lesion, right? So here also it would be same. So this would be homonymous hemianopsia. Still, there are so many other variations also, but basically it is this. So this was about the arteries part. Now we talk about the veins, right? Veins are much more comfortable because their final destination is known to you, right? Those dural venous sinuses. So veins, they do not follow arteries. First thing, they do not follow arteries, right? Do not follow arteries. But one thing is very clear, that brain consumes about 20%, 20 to 22% of cardiac output. So much is consumed by the brain even when the brain is at rest, right? It consumes large amount. So these veins, they are divided into two parts. They are divided into two parts. One would be the superficial, and second would be the deep veins, simply from their locations. But then there are few specialities of these veins of the brain, not like those other veins of the body. One, they are very thin-walled, very thin walls, right? Second, no valves. They are totally valveless. And third and most important point is that there is no tunica media, right? There is no tunica media. This means what? This means just one thing. There is no muscularis layer. right? There is no muscularis layer. Muscularis layer. That's the reason that they can expand. They can expand more. So can expand more. This is the reason that whenever the aneurysms are, so they can crazily they can expand and they can affect the neural structures. One basic thing that all these veins, right? All these veins, superficial veins, so they will be supplying, they will be draining superficial area. Superficial means it is outer. We go back to our logic. Outer is what? Outer is called as cortex. Cortex means what? Cortex means it's a gray area. Easy. So now you can say that these superficial veins, they supply outer cortex or the gray area, gray matter of brain, right? Very logically, there would be the deep set, right? Which is over here. We have not yet touched it, but yes, it would be supplying what? It would be supplying the deeper area or the inner area, right? It will be supplying the inner area. This inner area would be the white matter, right? And what else? Inner cortex and the medulla, right? So that's fine. So, but inner and the white matter, these are the deeper structures. A small figure, right? We draw a small figure, and this figure will tell something very interesting. Here is our brain. Here is our brain, right? There is a pia matter which is snugly attached with, and it goes with the folds of the brain. So that is the pia matter. So this is pia matter, right? After pia matter, there is arachnoid matter, right? In between arachnoid matter, this is the area which is called as the subarachnoid space, right? So this is subarachnoid space, and this subarachnoid space is the residence of cerebrospinal fluid. ठीक? After that, after arachnoid, this is CSF, right? We just write CSF here. After this arachnoid layer, there would be dural layer, right? But dura has got two layers. One is the periosteal layer, one is the meningeal layer, and second is the periosteal layer, right? So this is the outer one, that is the periosteal dura. And then there is another one which is called as the meningeal dura, right? And this space is called as the subdural space. And where were all those apna dural venous sinuses? Dural venous sinuses, because normally this periosteal layer and the meningeal layer, they are all snugly attached. But when the venous sinus is to be prepared, right, they create that space. So our dural venous sinuses, they are here, right? That's where our dural venous sinuses are there. Now the picture is complete. So where are our superficial veins? Our superficial veins, they are sitting in the subarachnoid space, right? This is the space where they are sitting, right? This is where our veins, they are. Now these veins, these superficial veins, they pierce all the way. They pierce this arachnoid matter, right? They move further. They pierce the meningeal dura layer, and they end up in dural venous sinuses, and that's where they drain. This is path of superficial veins, right? So they pierce all these layers, and then they drain into, say, dural venous sinuses. Dural venous sinus. Fine. No, arachnoid granulations, they are different. Arachnoid granulations, they are different, right? Because what arachnoid granulations would be, because they will be carrying, they will be for the CSF drainage, right? This we are talking about the blood, right? Not the CSF. Acha. In dural venous sinuses, over here, the which vessels which we need to take care of, right? Which are the major veins? One, superior cerebral vein, right? And then if that is superior, so there has to be one that is called as the inferior cerebral vein, right? Remember, now we are dealing with the veins, right? In between, so we'll call that as middle cerebral vein, है ना? Middle cerebral vein, middle cerebral vein. Two names, same, two arteries, same name. So we have to just change, make a small change, and that is, say, superficial middle cerebral vein. So then other is deeper? Yeah, there is. So then it will not come here, because right now we are talking about superficial veins only. Got the idea? We are talking about superficial veins. Superficial veins means they are not small veins, but these are the veins which are on the surface, which are present into the subarachnoid space, right? So this is one. So then what's here? These are called as the anastomotic veins. Anastomotic veins. And these anastomotic veins, there are two parts. There would be one which will be superior anastomotic vein, and then there would be inferior anastomotic vein. Let's see them and then we talk about it. The superior cerebral vein, it will drain into superior sagittal sinus. Simple. Superior cerebral vein that will drain into. So we do have, here it is. Let's name this so it will become much easier. See, all these, right? This one, so many, right? They are superior cerebral veins. Superior cerebral veins. And where are they draining? This top one is superior sagittal sinus. Correct? Superior sagittal sinus. So then that superior sagittal sinus, so in that case, when it goes down, right, there would be inside, there would be the inferior sagittal sinus, right? Then that inferior sagittal sinus, let's try it quickly. Superior sagittal, inferior sagittal, this would be the confluence, so this one would be the straight sinus, and then as it will go down, this one would be the occipital sinus. Then from here on both the sides, right, there would be transverse sinus, right? Transverse sinus, and this transverse sinus will move forward, right, and will take a turn. So this one would be called as the sigmoid sinus, and then that will go into internal jugular vein, right? Internal jugular vein. That's how it ends, right? These are the sinuses, dural venous sinus. So on top, what we are watching is the superior sagittal sinus. Then what we are watching, color. Then what we are watching, see, this is no doubt about it, internal jugular vein, this one, right? Then the shape itself is telling this is sigmoid sinus. Sigmoid sinus, right? And then something which is going on the occipital bone, which is into the center, which is dividing cerebellum into two halves. So this one, this is what we are talking about. That is the occipital sinus, correct? Occipital sinus, occipital sinus. And then going on both the sides. So this one, that is the transverse sinus. This area that is also called as the confluence of sinuses, and it was toss, right? So that's the transverse sinus, which is like right and left, right? It comes from both the sides. And then there is occipital sinus, we talked about it, right? Then there is superior sagittal sinus, we talked about it. And then there is a straight sinus, that straight sinus which is over here, but right now in this image it is not there, right? Because it is deeper. So that's the straight sinus which will be, say, covering up. Now, two things to be seen in this. One, right? Then we'll be going for those veins very quickly. This bigger one, this is a big vein, right? This is this one I'm talking about. So that one is inferior. Say that is that big vessel, great cerebral, right? This is what is called as the sylvius. Those can you see these are superior cerebral, and this one, that is the inferior cerebral veins, right? Superior cerebral and the inferior cerebral veins. So these are the veins, and then we want to talk about this superior cerebral. Say over here, we were writing over here, right? Superior cerebral veins, they drain into superior sagittal sinus. Done, right? And these superior cerebral, they will be taking care of what? Frontal, parietal, then occipital, right? They are everywhere, right? So in frontal, right? So it will be taking care of anterior portion, then lateral portion, medial portion, right? All those things will be taken care of. Similarly for the parietal, so it is this part will be taken care of, then this part would be taken care of. But when it will come to this posterior part, right, there is no anterior portion of occipital lobe, right? So in occipital lobe, it will take care of the posterior part and obviously the medial part, right? So things to watch out for this is that in frontal and parietal, the things are fine, that it will take care of anterior region and the medial, anterior or the medial region and the anterior surface. While in case of occipital, it will take care of the posterior region, right, plus the medial part, right, the medial surface. So that's like superior cerebral vein, right? The first one. Okay. So this is done. The next one is this superficial middle cerebral vein. That was the vein which we used to watch. This is the second one, right? So we'll just write over here middle cerebral vein. We are dealing with superficial, so this is superficial. And that's the name, Sylvius. So this is superficial middle cerebral vein. Situation is lateral, right? So this is lateral surface. Lateral surface. It takes care of lateral surface. Here it is. So I'll just write over here Sylvius. superficial, sorry, superficial, and it is the middle cerebral vein. So superior cerebral, inferior cerebral, and the middle cerebral vein. Now this middle cerebral vein, right, that is the sylvius, that will be draining where? This is pretty interesting. This will be draining into cavernous sinus. Cavernous sinus. So as we were drawing, superior sagittal, inferior sagittal, right? And then straight sinus, and then there is occipital, then there is transverse, right? And then it is going further, sigmoid sinus and into IJV. Over there was the cavernous sinus, and then this was getting connected like this by superior petrosal and the inferior petrosal sinuses, right? And in between two cavernous sinus, there was anterior and posterior intercommunicating sinuses. So this is the location of that cavernous sinus, right? Because it is centrally situated. So now it makes sense that when we say this sylvius, as it dips down, right, as it dips down, right, as it dips down, then it will be going underneath and will land into cavernous sinus, right? So this is when we say it lands into cavernous sinus. Two more anastomotic veins, and both of them, they are in reference to our this middle cerebral. One would be the superior and second one is the inferior, right? We are talking about veins. So this superior one, this one, this is called as vein of Trollard. Vein of Trollard, right? And then there is another anastomotic vein. This is the vein which we are talking about. This one. That is called as vein of Labbe. Labbe, vein of Labbe. These both are anastomotic veins. So what are they doing? Basically connecting sylvius, right? So anastomotic vein, right? The sylvius, and sylvius is what? Sylvius is our superficial MCV, superficial middle cerebral vein. So that's sylvius, right? Superficial middle cerebral vein. So from sylvius, this gives the anastomotic link to superior sagittal sinus. Here it is, right? Here it is, right? From sylvius, it is getting connected to superior sagittal sinus. Fair enough. The second one, which is inferior communicating, the thing what we call this as Trollard, right? Trollard, vein of Trollard. And this one inferior communicating, that we call as Labbe. Labbe. So that would be connecting sylvius to transverse, right? So this is sylvius to transverse. And how the transverse is getting formed? Well, remember that confluence toss, right? Remember toss. So this is this one, toss, which is on both the sides, because that goes on to the inside of the occipital bone and it goes on both the sides. So that is the transverse, right? So we have got superior sagittal from top, then inferior sagittal. Inferior sagittal meets superior sagittal with that straight sinus. Then there is then there is transverse sinus, which is going like this, and then there is occipital, right? Occipital is into the center and divides cerebellum into right and left hemispheres, right? So this is This is that, and this is that labbe. The specialty of labbe is that sometimes when you do angiography, you won't find it. So this is the thing. That's why not always present. It's not always present, right? But if it is present, it takes care of this much. Okay. So this was our what? The Sylvius and the Trollard and the Labbe, right? These smaller ones, inferior cerebral veins, right? All these one, this one, this one, this one, right? All spread across. So these are all inferior cerebral veins. Just by the looks, you will be able to tell that this is inferior cerebral veins, right? What do they do? Temporal area, right? See the image. So this is like temporal area and some portion of the frontal. And which portion is this? Well, this portion, this is for the orbital portion, right? This is the orbital portion just underneath. This is the orbital surface. So this inferior cerebral vein, right? They would drain what? They would drain two lobes. Temporal, so it is Bindas Dadagiri, right? Because they are the only ones present over there, and the frontal. In frontal from that orbital surface, right? Orbital surface. And in temporal, that inferior and lateral, right? Because that's where they are. So this is inferolateral surface. That's what it is drained. So thus all these veins, right? They have got the option, right? They have got the option. They will drain into that nearest, these infracerebral, right? They will be landing into nearest dural venous sinuses. Who is near to them? Well, there is transverse sinus, right? So they can end up in transverse sinus. Then they can end up in superior petrosal. You remember superior petrosal, which was going all the way to the cavernous sinus, right? Superior petrosal sinus. Then cavernous sinus itself, right? Cavernous sinus. Then the inferior sagittal sinus, right, can land over there. And the deep veins, in the deep vein, there is one vein from where it can go, and that is the basal vein. Right? This is a deep vein. So things can land over there. So this is how everything is spread across, right? So when we talk about superior cerebral vein, so we have got the superior cerebral vein, we have got the superficial middle cerebral vein, which is called as sylvius, and the inferior cerebral vein, right? So we summarize it like that. When we talk about superficial, right? Superficial. So these are cerebral, right? Cerebral veins, and those superficial cerebral veins were like superior cerebral, right? So there was superior cerebral, multiple veins were there, right? So superior, all are cerebral, so we are not writing cerebral. So that is superior. Then the inferior, right, which we were just talking about, inferior cerebral, and this two in between, that was sylvius, right? And from sylvius, when it was going up, it was Trollard, where it was communicating link between sylvius and the superior sagittal sinus, right? Got it? Right? See over here, right? And then second one is labbe, which is going into the transverse sinus, right? All the way into the transverse sinus. So when it goes like this, right? This is labbe, right? And it is going towards the transverse sinus. But this is not always, right? Not always. Sometimes it is absent. So this sylvius is also superficial. This is superior, this is inferior, this is middle, right? So this is superficial, middle cerebral vein. All are cerebral veins, so that's why we have just written superior, middle, and inferior. Right. So these were the superficial veins. For the deeper veins, same structure, right? Where is we have got one image. So we just write few points, major points, and then we talk about. So these are the deep veins. These are the deep veins, right? Again, cerebral. So in that, only one major one, right? That is what is called as the great cerebral vein. This is great cerebral vein of Galen. Right? We would like to see that where exactly it is, right? Here it is. Let's highlight it. This one, right? So where is it trying to go, right? See, it is all those internal cerebral vein, basal vein, right? These are the main tributaries which will be coming from all the surroundings. And then see, this is like a link, right? This is like a link. So let's take it like this. That great cerebral vein of Galen, right? This is a deep vein, right? This is a deep vein, and it is formed by, how is it getting formed? It is formed by all those tributaries, right, which are coming, and they are like nadi, right? They are coming, and they are forming this this cerebral vein of Galen. So formed by one, it's called as the internal cerebral, right? Internal cerebral. There is one vein which is called as the basal vein of Rosenthal, right? But so we just say basal vein, and obviously the cerebellar vein, right? Superior cerebellar vein. These are superior, right? So with this, that vein is formed, and this is just near to the base of the third ventricle, and this vein will go straight away into, there was only one, and that is the straight sinus. So we remember two things. This is our Galen, great cerebral vein of Galen, formed, and it lands into straight sinus. Point is this: it drains what? It drains what? It drains cerebellum. It drains cerebellum. It drains lateral ventricle, third ventricle, right? In fact, to be more precise, the choroid plexus, right? Choroid plexus, that is what is drained. And obviously the midbrain, the lower portion, right? So midbrain, this is what is drained. So then what about the pons? What about the medulla oblongata? Well, there are specific separate veins for them, right? We saw the pontine arteries, right? But so same style, right? We have the rest of the veins which are for the brainstem, right? These are the veins for brainstem. So there would be, say, vein for midbrain, we saw, right? Then there would be pontine veins. which are for pons. Similarly, there would be medullary veins, which are for medulla oblongata, right? They will be draining it. So this is the layout for all these vessels, right? We just see, yeah, this one. Very quickly we see this thing. See, this top is superior sagittal sinus, right? Though I've shown you this image even before also, but at that point I said we are not talking about certain veins right now. We'll talk about it later, right? Now is the time, right? So we see this is the superior sagittal sinus, right? Then if that is superior sagittal sinus, right? How wonderful this is. This is the inferior sagittal sinus, right? If that is the inferior sagittal sinus, so this is the area, this is where everyone is meeting. So this one would be, sorry, this one would be the straight sinus. This one would be the straight sinus, right? In straight sinus, what was landing? There was vein of Galen, right? Great cerebral vein, thick, big vein. See how big it is. This one, right? So that is the great cerebral vein of Galen. Then this one is internal cerebral vein. That one is internal cerebral vein, right? And then there are all those precentral veins and all those veins, they will be coming over there, right? Wormian veins, this. But that we'll see when we'll be learning those structures, right? But this is in general. So that's how, say, things are there for the blood supply of the brain. Regarding the dural venous sinuses, right? We know this part. This is superior sagittal, then there was inferior sagittal, this was the straight one, right? Straight sinus, and then this is, if you draw it like this one would be the occipital from both the sides. This is the transverse, that transverse which will go front, and then it will go for sigmoid sinus, and then the internal jugular vein. Then over here, that would be the, say, cavernous. This is superior petrosal, this is inferior petrosal. And when we say that on the opposite side also there would be the cavernous, so when they join, so there is anterior and posterior intercavernous, right? So these are all dural venous sinuses where things finally drain, and internal jugular vein, that is the final exit, and then it goes to the brain, right? Saving all of it. So now everything is in sync. Okay. Right. So this was the blood supply of the brain. Thank you so much. Right. I'll just put this file into our folder. Go through these images. Do write. Do try to practice these diagrams so that you are very comfortable with it. My wish is that we watch some of the interesting cases also. Right. No doubt. We'll see it later. But yes, so that you should be able to identify, right? First we'll see the normal structure, and then we'll see all the pathologies. Thanks a lot, and see you soon. Bye bye.